Hello, my name is Dr. Stephen Stockdale, and I'm a licensed clinical psychologist in Colorado Springs, Colorado in the United States. And I've been a QEEG and neurofeedback provider for the past 25 years. Today I would like to talk to you about the Deymed Diagnostic TrueScan 32 QEEG neurofeedback system. It's a very high-end, technically very good piece of technology. It has very high specifications. The sampling rate for this system is 4,096 hertz per channel. So as a result, we're able to get a very clean, crisp, clear EEG signal. The best way I can really talk to you about the outstanding features of this system is to show you. So we're going to take a few minutes for a quick tour of the TrueScan 32 QEEG neurofeedback system. So we're going to move over now to our computer screen. To begin with, let's take a look at our QEEG amplifier. And as you can see, it's very lightweight and portable. It can be held in my hands, and it has an internal rechargeable battery which will keep its power and not need to be recharged for several months. So you see, it's very lightweight, portable, and easy to use in that regard. Now if we take a moment and actually go up to our computer screen, we're going to begin by looking at the top left part of the screen. Now the Deymed system uses what they call a dashboard interface, which makes the computer very easy to use in terms of its software applications. Everything we need is right on the screen. To begin with, if we look down here, there's a number of pre-written EEG montages, and we're going to select one for our demonstration today, a linked ear montage, as you see here. And then here's some of our easy to use features. Once the patient name has been entered, the patient name appears here. We have a record button, a pause button, which is grayed out, and a stop button, which is grayed out until we start actually collecting data. We can monitor the speed at which the EEG goes across the screen. This is our paper speed. We can change the sensitivity. We can also look at our filter settings. This set of filters go between 0.02 hertz and 2 hertz, and this set of filters goes between 20 hertz and 450 hertz. We also can write our own montages here if we don't like any of the ones that are pre-written by the Deymed diagnostic technicians. And we can, if we look at the center of our screen now, we can see a montage editor right in the software. So we can write any kind of montage we want for looking at the data, either while we're collecting it or in our offline analysis mode. Let me go ahead and close this window. We'll go back over here to the bottom left. We can also see a nice feature of the Deymed software. So we see how much space we have left on the hard drive of our computer, and we can see the amount of charge that we have on our battery. Now if we look up to the top of our screen, this is one of the very significant things about the neurofeedback and QEEG software. Deymed has the only system in the world that can simultaneously record QEEG and record impedance simultaneously. Now when we actually start putting the sensors on the patient's head, and we want to see this a little bit better, we just click on this, which is always here, and it enlarges this. So as we're preparing the patient for collecting the data, it's easy to see. Once we have those good impedances, we can just close this window, and then we want to get rid of the patient names that are on the screen. So we go back to our bottom left. There's a little button that says Zoom. We click on that. The patient information is gone, and now we can see the EEG going across the whole screen. Now we're ready to collect data. So if we look at the top left part of the screen and I click the record button, as I spoke of earlier, it activates the pause and the stop button. Once we have collected the adequate amount of data for our quantitative analysis, we simply hit the stop button and the data is automatically saved for us. Now on our computer screen, if we look at the top and just to the right of center, we have some tabs here for some other software features, but we're going to look at the BFB tab, which is brain feedback. We'll click on that. This has the same easy to use software interface. What we simply do is create an individualized protocol for the patient and put in their conditions for training. We can select where the electrodes go on the head. We can select what kind of training we're going to do. That training can include amplitude training, customized training, which is amplitude asymmetry training, coherence training, Z-score amplitude, Z-score relative power, Z-score coherence, Z-score phase, and we can also do Loretta neurofeedback training. In terms of things to come, the Deymed software in the future will also be able to do DC channel, DC current training as well. Once we've set up the protocol for the patient, then we simply need to pick the feedback display that the patient would like to use. And we have 25 different neurofeedback games that the patient can use, and we also have the option for DVD as a feedback display. Finally, we have different choices for auditory sounds when we do the training. We can look at a number of pre-written sounds by the Deymed system, or we have a number of MIDI tones and sounds that can be used as well. Again, this software is very, very versatile. It's got tremendous flexibility. It's very, very easy to use, and it is just outstanding in terms of the speed at which one sees changes in the patients and good clinical outcome. Now, with that in mind, what I'd like to do now is take the opportunity to give you my contact information so that if you wish, we can further discuss this technology. My website is neurohealthcenterstevestockdale.com, and I can be reached by telephone at 208-642-9300 or 719-229-2831. It's been my pleasure to speak with you today. Thank you so much, and I look forward to speaking with you in the future.